Hi, my name is Lisa Ledford. I am a student at Chattahoochee Tech. The course I'm taking is ECCE 1103, Child Growth and Development. Today, I'm going to be talking about Toddlers Biting, spotlighting information from the website www.0to3.org and from the textbook Child and Adolescent Development in Your Classroom. Today, I'm going to cover three main topics about toddlers biting. First is why toddlers bite. Second is how to respond to a toddler when they bite and what steps to take when a bite occurs. And third is what child care providers can do to try and prevent future biting in the classroom. Toddlers biting can be a very common behavior with up to half of them experiencing it. Biting is most common in toddlers, particularly between the ages of 1 and 3 years old. According to the textbook, Child and Adolescent Development in Your Classroom, boys are more likely than girls to show aggression at this age, which includes biting. There are many reasons why toddlers might bite. They may lack the language skills to properly express their emotions and feelings. They could be overstimulated from lots of noise and activity or overly tired. Teething and the need for oral stimulation could cause them to bite. Toddlers learn by observing others. If they see another child bite, they may imitate that behavior. They might also use biting as a way to defend themselves or to set up boundaries. Understanding why a toddler might bite can help parents and caregivers respond effectively, teach appropriate behavior, and support the child's development. According to the website www.0to3.org, trying your best to understand the underlying cause of toddler biting will help you develop an effective response. When a bite occurs, it's important to stay calm and separate the children. The immediate focus should be on the child who is bitten. First, assess the bite. If there is an injury, clean it with soap and water. If the bite is deep and bleeding, get medical care. Then, after the bite is assessed, offer comfort and reassurance to the child. Once the bitten child has calmed down, it's time to address the child who bit. When addressing the child who bit, use a firm "no biting" or "biting hurts." Use simple and easy to understand words for a toddler. It's also important to not shame or embarrass the child who did the biting when you are speaking to them. Once the immediate situation is addressed and the biter has calmed down, you should try and redirect their attention. You can do this by offering a different activity or toy. If you are a child care provider, there are several different ways you can try to prevent and discourage future biting in your classroom. Having predictable schedules and routines for the children will help to provide them with stability and comfort. You should also provide a wide variety of toys for play along with engaging activities for them to do to keep them occupied and to reduce boredom and frustration. It's important your room is designed to allow enough space for the children to be able to engage in group play as well as independent play. It's also imperative to always provide close supervision at all times and to have a low child-to-staff ratio. Caregivers should always show a great deal of patience as well as trying to use consistent techniques on how to handle things when a bite occurs. I hope this video overview helps you better understand why a child might bite, what to do when one child bites another, and how to possibly prevent or reduce biting in your classroom down the road. Remember, not all children bite, but any child may, so be ready and know what to do if it happens. Thank you.